In this episode of PH Insights, we'll take a closer look at PHA's long-standing commitment to advancing research as part of its mission to extend and improve lives affected by pulmonary hypertension. Through your support, the Pulmonary Hypertension Association is able to invest in research and advocate for policy change, which will hopefully bring us closer to a future without PH. Leading today's conversation is Dr. Matthew Lammi, the current Research Committee Chair for PHA, and joining him is researcher and associate professor Dr. Nadine Al-Naamani, who will share more details on the impact that PHA has had in her research and what it means for PH. Let's get started. Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension.
Hi, everyone. I'm Dr. Matthew Lammi. I'm thrilled to be here for this special episode of PH Insights. I'm honored to serve as the current Research Committee Chair for the Pulmonary Hypertension Association. I'm currently at the Johns Hopkins University in Baltimore, Maryland. And in my role at PHA, I've seen firsthand the impact of PHA's commitment to research, funding a wide array of research initiatives that lead to significant advances in the field. Today, we'll be talking to a remarkable researcher, Dr. Nadine Al-Naamani, who has been a recipient of a PHA research grant. Nadine, welcome, and thank you for joining the podcast today.
Thank you for having me, Matt.
All right. Well, let's begin with some introductions. Nadine, could you tell us a bit about your background, your work, and the PHA awards that you've received?
Yes, my pleasure. I'm a pulmonary and critical care trained physician who is currently an assistant professor at the University of Pennsylvania. My clinical and research focus has been on patients with pulmonary vascular disease, particularly patients with pulmonary arterial hypertension. I was fortunate enough to join Dr. Sienkiewicz's research team as a postdoctoral scientist back in 2006, and I was the lead coordinator for an NIH-funded clinical trial in patients with pulmonary arterial hypertension. I had the unique opportunity to be engaged with patients living with pulmonary arterial hypertension and was able to follow them over time, both of which inspired me on my personal journey as a pulmonary hypertension researcher.
Well, that's great. I think it's really interesting how you went from having some coordinator experience to then being the principal investigator for different studies. How do you think your experience doing the research coordinator role kind of launched you into your career pathway?
Thank you for that question. So when I started as a research coordinator, I had no experience in clinical research whatsoever. And it was a very steep learning curve, learning on the job. But I was able to experience firsthand the impact that research has on developing and understanding diseases better, and then developing treatments that can help promote health in these patients with pulmonary hypertension had a particular impact on me, given how this disease affects every aspect of their life, their quality of life, being able to do their everyday activities. And the physiology of the disease fascinated me in and of itself. And so when I did my retraining in the United States, I did it with a purpose of going into pulmonary and critical care, specifically to further understand pulmonary hypertension.
Yeah, I think that's very interesting to hear your journey towards being a PH researcher. I think one of the key topics we wanted to explore is how receiving a PHA research grant has impacted your career and your research trajectory. Nadine, can you share a little bit about how the Aldrighetti Award shaped your journey and what topics you've studied under that grant mechanism?
Absolutely. As a junior investigator trying to establish your line of research, receiving an award like the Aldrighetti Award is extremely significant. It not only provides you with funds to pursue the research question at hand, but it also provides validity to the research topic and to the junior investigator. Investing in junior researchers is instrumental in allowing them to establish the scope of their research, gather preliminary data, and then secure additional funding from institutions like the NIH or other foundations. This was the case for me. Securing the Aldrighetti Award allowed me to conduct the proposed research and use the data to continue to pursue my overarching research goal, which is understanding the role of obesity and more broadly body composition in pulmonary arterial hypertension.
And can you share a little bit of interesting findings that have resulted from this research?
Yes, of course. My research has focused on understanding the impact of obesity on patients with pulmonary arterial hypertension. We all know that obesity is a heterogeneous disease, so the impact of obesity in pulmonary arterial hypertension particularly is nuanced. I used the Pulmonary Hypertension Association Registry's data to look at the prevalence of obesity and its associations with outcomes in patients with pulmonary arterial hypertension. And we found that obesity is associated with greater impairment in their exercise capacity, greater symptom burden, and worse quality of life. But at the same time, we also observed that patients with obesity had better survival as compared to patients who had normal body weight. With the Aldrighetti Award, I was able to use harmonized data from multiple randomized clinical trials of pulmonary vasodilators in pulmonary arterial hypertension to explore whether patients with obesity derive greater benefit from treatments as compared to normal weight patients, which might explain why they had better survival. Surprisingly, we found that patients with obesity had a reduced response as compared to patients with normal weight with treatment when it came to having less improvement in symptoms limiting daily activities. So I then went on to kind of try to understand this further, and we have now identified that certain fat depots in the body, especially the fat surrounding the heart, as well as like the muscle mass that individual has, are more important than just the body mass index, which is a crude measurement of that is used to define obesity. And these particular fat depots and muscle volumes, they have more impact on outcomes for patients with pulmonary arterial hypertension. We are currently focusing on further understanding how pulmonary arterial hypertension affects body composition in individuals. And we're trying to explore ways of improving patients' symptoms and exercise capacity, as well as quality of life, through non-pharmacologic interventions focused on nutrition and exercise.
Just so many interesting findings that you've mentioned. I know that a lot of people talk about the obesity paradox, that in general, obesity is felt to be a condition associated with worse outcomes, but in PAH, it seems to be associated with improved outcomes despite worse quality of life, as you mentioned. Have you or anyone else looked at the role of weight loss and how that affects things like quality of life and exercise capacity in PAH?
I am not aware if there is a study that particularly has looked at weight loss and how that improves outcomes in pulmonary arterial hypertension. However, from like literature in the bariatric realm, we do know that patients who undergo bariatric surgery and have significant weight loss do have significant improvements in their cardiopulmonary hemodynamics, regardless of having been diagnosed with pulmonary hypertension previously. I think it's going to be very interesting now in the era of GLP-1 agonists to see how that is going to affect patients with pulmonary arterial hypertension. When we did look at the data from the Pulmonary Hypertension Association Registry, we did not significant changes in weight over time in the patients who were enrolled in the registry at the time that we did that analysis. Most patients kind of remained within the same weight range that they started off with after 3 to 5 years of follow-up. But what we have seen from our research is that the patients that we normally classify as having normal body weight with pulmonary arterial hypertension may have low lean muscle mass. So with substitution of muscle for fat, as opposed to actually having normal body composition. And I think patients who have a higher body mass index, whether they fall into the overweight or obese range, may have better outcomes if they have sustained muscle volume and not just muscle loss with fat replacement.
Yeah, I think it's great that you're highlighting the limitations of BMI and that it's a lot more complicated than just a simple number. Are there any clinical tools that you think in the future could be used to look at body composition and PAH that could help us direct treatments a little bit more precisely?
So right now, the gold standard for looking at body composition is performing whole body DEXA scans. And we are using this tool as our gold standard in my research in patients with pulmonary arterial hypertension. However, we do understand that this is not something that is routinely ordered on patients with pulmonary arterial hypertension. And so we're trying to validate using chest CT scans, which we know are at least obtained at the time of diagnosis, workup, evaluation of a patient with pulmonary hypertension, and using measures of fat as well as muscle on chest CT scans as a gold standard for identifying patients who are at higher risk of muscle loss, frailty, and that would benefit from more targeted approach at increasing muscle mass and exercise treatment programs.
Yeah, that's wonderful. And Nadine, I know you've done a lot of amazing research related to obesity, but also have a lot of interests in sex-related differences and sex hormones in PAH. Any interactions between what you found with obesity and how that relates to sex and sex hormones?
That's a great question, Matt. And there are well-known differences in the sexes between patients when it comes to body composition. And so when we're looking at lean muscle loss, we are adjusting these variables to sex-based references because we know that body fat distribution differs between the sexes, between males and females, with like different propensity for subcutaneous fat deposition in females, a higher propensity for visceral fat deposition, and visceral fat is the fat that surrounds organs in males. And so we are looking at all these sex differences when we are examining body fat composition in patients with pulmonary arterial hypertension. I also mentioned that I'm interested in looking at nutrition and diet quality in patients with pulmonary arterial hypertension. And we've also conducted a small study examining the diet quality of patients with pulmonary arterial hypertension and found some differences between the sexes as well in terms of like consumption of sugars, added sugars, in terms of consumption of protein that differ between the sexes, which kind of also mirrors the general population differences between sexes. So I think we need to be very careful when we're studying these phenomena to try to understand how the sexes differ so that we can provide more tailored approaches to interventions to help these patients.
Yeah, I really love the patient-centered focus that your research has, because I'm sure this happens to you all the time. The patients come in and ask about what diet should I be on? What's the best diet for PH? I'm always a little bit of a loss to give recommendations other than just the sort of general advice that we give all people for their diets. Do you think there's any specific PH diets that in the future could be developed, or is it just going to fall back on kind of general health quality?
I think we need to, as part of the multidisciplinary approach that we have for treating patients with pulmonary hypertension, we need to incorporate nutrition counseling as part of that. Oftentimes, and especially with busy clinical practices, you end up telling the patient, like you said, basic, generic, avoid salt, don't drink a lot of fluids, but we don't tell them and don't give them advice on what to do. And that leaves patients in a little bit at loss of what to substitute. So when you tell patients avoid salt and don't give them alternatives, we end up in a way being guilty of pushing patients towards a more calorie dense but nutritious free diet. Sometimes inadvertently this might happen. Salt is in everything that we consume: breads, cheese, salad dressings. So there is not an easy way to just take salt out of your diet. And so without giving appropriate nutritional counseling, we may be causing some harm to patients by not giving them healthy alternatives that they can revert to. So I think incorporating nutritional counseling into comprehensive pulmonary hypertension care is going to be a crucial step towards improving the diet quality for patients with pulmonary hypertension.
Well, thank you for shining a light on such an important topic in PH. Could you describe a little bit about how you see the future directions for your work and what kind of impact that will have on treatment approaches in the future?
Yeah, so like you said, I am very focused on improving the patient's quality of life and improving their outcomes as much as possible. I am very interested in helping them be able to do more with their lives. And part of that is through trying to, again, combat the factors that impact outcomes in pulmonary hypertension outside of just the heart and lung by impacting nutrition, muscle health, through exercises that the patients can actually feel comfortable performing and have the ability to sustain over time. I think it's very easy to tell somebody, I need you to exercise more, go to the gym. We all know that our patients spend the majority of their time in sedentary activities, partly because of the limitation from their heart and lung physiology, but also because they may not have the social support to have somebody accompany them to go to an exercise program, or maybe because of financial restraints. So I'm also very cognizant about trying to find interventions that patients can implement safely at home on their own that will continue to improve their quality of life, even if it is in small increments.
Yeah, that's wonderful. I can tell that the Aldrighetti Award was pretty critical to your career at an early stage of your investigator career. With growing research endowment funds, annual awards from the PHA, I think the Pulmonary Hypertension Association really aims to ensure that important work like yours continues. Nadine, what are your thoughts on the importance of PHA's ongoing support for research?
I think the work of the PHA in general has been crucial for the betterment of the lives of patients living with pulmonary hypertension through multiple avenues, whether it's advocacy, education, medical education, and research. While we have been making significant strides in improving the life of patients with pulmonary hypertension, there are several more gaps in our understanding of the disease and how it impacts patients. The Pulmonary Hypertension Association understands the importance of advancing the research in pulmonary hypertension, and through its support of the research endeavors in pulmonary hypertension, it is ensuring the training of new and promising researchers in the field. It's supporting basic science, preclinical and clinical research with the goal of finding a cure for pulmonary hypertension and improving the lives of patients living with pulmonary hypertension.
Yeah, I think you make a lot of great points there. I'd also be interested to know if you have any advice for investigators that are just getting started, maybe people ending their fellowship or just starting their faculty appointments, since you're, I think, moving from junior investigator to more mid-career. Any advice regarding PHA involvement or research grants that the PHA supports that may be useful to them?
I think the Pulmonary Hypertension Association is a wonderful place to launch your career. I think they provide a lot of accessible funding opportunities for early and junior investigators to help kind of establish yourself in the research world. In addition, I think the Pulmonary Hypertension Association, between the scientific leadership, the Pulmonary Hypertension Association Registry, it opens up a network of pulmonary hypertension providers across the country that is invaluable, especially at early stages of career, that allows you to collaborate with other researchers that may be working on something similar or may be able to mentor you remotely or collaborate on a project together. I think the Pulmonary Hypertension Association is a wonderful network of physicians and researchers, and tapping into this is very important, especially at your early stage career.
Yeah, I think that's great insight. I personally have also benefited greatly from PHA's support through the years. So to wrap up, I just want to say thank you for taking the time out to do this podcast today. I think it's been really interesting to hear about the great research that you've done and how the PHA has helped supported that. I think it's clear that PHA's support is having a lasting impact, not only on individual researchers like yourself, but the whole field in general. So for those listening, as we approach the end of the year, consider supporting PHA's fundraising efforts to ensure that this critical research funding continues. So once again, Nadine, thank you so much. And I really look forward to all the great things that your research will do for our patients.
Thank you so much for having me, Matt. And again, thank you to all the PHA donors and to the PHA for supporting researchers like myself so that we can continue to try to do our work with pulmonary hypertension patients.
And thank you for listening to PH Insights presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insights. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content or programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.